Hi, I'm Abby Phillips. This is my fourth video, and I will be going over infection control. All right, so I found this chart showing the guidelines to infection control for PFTs or pulmonary function testing. So use universal precautions and expanded precautions if necessary. If your patient has a suspected infectious airborne disease, you need to wear your N95 respirator. Mouthpieces or flow sensors should be disposable or disinfected between patients. Nose clips, mouth seals, valve holding chambers, and a small volume nebulizer should be disposable, and those should be single patient use. The use of inline filters does not eliminate the need for regular cleaning and disinfection. When administering aerosolized medications, the most effective way to avoid cross-contamination of the drug would be to administer it with a metered dose inhaler. So how should PFT equipment be disinfected? So pulmonary function equipment requires thorough disinfection to prevent the spread of infections. After each patient use, disposable components must be discarded. So non-disposable parts such as mouthpieces and tubing. I know some, well, it's more rare now for them to be non-disposable, but in some cases, I saw when I was researching that there is some non-disposable. Those should be thoroughly cleaned to remove visible debris and disinfected using a high-level disinfectant solution, following the manufacturer's instructions for contact time and concentration. Regular maintenance and calibration of equipment are also essential to ensure those accurate and reliable results. So equipment that is disposable and single patient use. Equipment that we use that is disposable is mouthpieces, which directly contact the patient's mouth, and single-use bacterial viral filters, which are placed in the airflow path to trap microorganisms. Nose clips are often disposable or require thorough disinfection between patients. Using disposable items ensures a hygienic testing environment and minimizes the risk of infection transmission during pulmonary function test assessments. So for a patient with isolation precautions for airborne precautions, testing should ideally occur in a negative pressure room. Healthcare workers must wear properly fitted N95 respirators. Proper hand hygiene before and after is the most important thing. The equipment should have disposable filters and mouthpieces, and thorough disinfection of non-disposable parts is crucial after the test. And you want to limit the patient's time outside the negative pressure room. Ensure they are wearing a surgical mask during transport.